Imagine waking up one morning and suddenly your legs refuse to obey your brain. Within days, that neurological emergency is called Guillain-Barré Syndrome. To understand Guillain-Barré Syndrome, we first need to understand the peripheral nervous system. These nerves carry electrical messages between your brain, spinal cord, muscles, and sensory organs. Healthy nerves are wrapped in a protective insulation called myelin. This allows electrical impulses to jump rapidly between nodes of Ranvier, making nerve communication extremely fast and efficient. In many patients, Guillain-Barré Syndrome begins 1 to 4 weeks after an infection. One of the most common triggers is the bacterium Campylobacter jejuni, which causes severe diarrhea. The bacteria molecules that closely resemble components of our own nerves. This phenomenon, known as molecular mimicry, tricks the immune system into attacking healthy nerve tissue. Antibodies, complement proteins, and immune cells mistakenly attack the myelin sheath. As this protective layer is destroyed, nerve signals slow down or stop completely. When myelin is damaged, electrical impulses fail to reach the muscles efficiently. This leads to weakness, numbness, and loss of normal movement. Guillain-Barré Syndrome usually causes ascending paralysis. Symptoms begin in the feet and legs, then spread upward to the arms, face, and sometimes the muscles responsible. If the nerves supplying the diaphragm become affected, the patient may no longer be able to breathe independently. This is why Guillain-Barré Syndrome is considered a neurological emergency. Neurologists combine the patient's history, physical examination, cerebrospinal fluid analysis, and nerve conduction studies to confirm. Diagnosis begins with a thorough neurological examination. Doctors assess muscle strength, sensation, cranial nerve function, and tendon reflexes. One of the most important diagnostic clues is cerebrospinal fluid analysis. After the first week of illness, the CSF typically shows elevated protein levels with a normal white blood cell count. Nerve conduction studies are then performed to assess function. This typically reveals a significant slowing of electrical impulses, a direct result of damage to the myelin sheath. Nerve conduction studies measure how quickly electrical signals travel through the nerves. In Guillain-Barré Syndrome, damaged myelin slows conduction velocity, prolongs response times. Guillain-Barré Syndrome has several subtypes. The most common is acute inflammatory demyelinating polyradiculoneuropathy, while axonal VAMSAN directly damage nerve fibers. Guillain-Barré immunoglobulin, or IVIG, is one of the first-line treatments. It supplies healthy antibodies that neutralize harmful autoantibodies, reduce inflammation, and prevent. Plasma exchange removes harmful antibodies directly from the bloodstream. By reducing the immune attack on peripheral nerves, this therapy can shorten recovery time when started early. Many patients require intensive care monitoring. Doctors closely observe breathing, heart rhythm, and oxygen levels because Guillain-Barré and autonomic nervous systems. If the diaphragm becomes too weak to support breathing, mechanical ventilation becomes essential. Temporary ventilatory support allows the lungs to function while the damaged nerves begin to recover. Supportive care is vital. Frequent repositioning, chest physiotherapy, deep vein thrombosis prevention, skin care, nutrition, and early physiotherapies long-term recovery. Recovery often begins slowly over weeks to months. As inflammation resolves and nerve function improves, patients gradually regain strength through rehabilitation. Recovery begins with rehabilitation. Physical therapy strengthens weakened muscles, restores balance, and retrains the nervous system. Schwann cells play a vital role in recovery by rebuilding the damaged myelin sheath. As the protective insulation reforms, allowing muscles to receive stronger electrical signals. Most patients recover well, but some continue to experience fatigue, weakness, or nerve pain. The extent of recovery depends on how severely the nerves were damaged. Guillain-Barré Syndrome can also affect the autonomic nervous system. This may cause dangerous fluctuations in heart rate, blood pressure, digestion, and bladder function. Nurses play a critical role in recovery by monitoring breathing, preventing infections and pressure injuries, maintaining nutrition with mobility, and providing emotional support throughout the patient's journey. Although Guillain-Barré Syndrome cannot always be prevented, reducing the risk of serious infections through good hygiene, safe food handling, and seeking early medical care, recovery usually occurs over several months. With early treatment and rehabilitation, many patients regain independent mobility. Remember the key sequence. Infection triggers an abnormal immune response. Antibodies attack peripheral nerves, weakness rapidly progresses. Researchers continue to explore new treatments, including targeted immunotherapies, regenerative medicine, and precision diagnostics, offering hope for even better outcomes in the future. Guillain-Barré Syndrome is rare, but it is a true neurological emergency. Early recognition and transform perostics. Understanding this disease helps save lives.